So when you're talking about scaling up, you're really talking about increasing the reach or impact of an intervention or an innovation that you know benefits people with a view to sustainability or to meeting an identified need. When an organisation is thinking about scaling up an intervention or an innovation, they're really asking three questions. So what is it, does it work, and does it fit? So when they're thinking about what is it, they're thinking about articulating whatever the model is that they're thinking of scaling up and identifying the key elements that are essential to make it work, without which it wouldn't be the intervention that we're talking about, or it wouldn't achieve the outcomes that they're looking to achieve. When they're asking themselves, does it work? They're looking at what's the evidence base out there for this intervention? Is that evidence base credible? And does that evidence base speak to the context in which they're talking about implementing the intervention or scaling up the intervention? When we're talking about does it fit, we're talking about does it fit within the service context in terms of the policies, procedures in place there, the other activities that are going on, the norms and values within that context, and also the broader national and policy context in terms of what the current priorities and needs are. So there's different routes to scaling up. So a service could increase or could expand their service offerings. That would be expansion. That would be one service increasing the number of people it reaches through its own means. Then there's replication, by which different services start offering whatever the new intervention to be scaled is. And there's also institutionalization. So that's changing a law or policy in order to ensure that everybody adopts the new innovation that's to be scaled. For example, the smoking ban or the seatbelt legislation.